All right, so this is going to be our lecture for promoting safety. Let me just change this square so it's correct. Okay, so promoting safety is chapter 24 in your FA Davis textbook. Um, and away we go. So, key terms that are good to know for safety are objectives for this lecture. Talking about what is safety. Safety is the basic human needs, second only to survival needs like your oxygen, nutrition, and fluids. So if you look at Maslow's hierarchy of need, we start with those basic survival needs, and then safety is the next block up. As a nurse, you're going to be fundamentally concerned with the safety of your clients. You may also be concerned with your own safety and safety of other care providers that you're working with. Many accidents and injuries can be prevented by being aware of the hazards and taking a responsible precaution. And then, according to the Centers for CDC, this was cited in 2015, accidents and unintentional injuries are the fourth leading cause of death in the United States. It's estimated that 130,000 people each year die as a result of an accident, and I'm sure those numbers have gone up. Your most common accidents, you have your poisonings, your motor vehicles, firearms, falls, and drownings. Falls in the hospital are probably the most common thing that we see. So we have many developmental factors that can affect our safety. And when you're caring for these different developmental age groups, you're going to have to modify your safety precautions to make sure that you're hitting their precautions. So infants and toddlers, motor vehicle accidents are the leading cause of death for ages 1 to 3. And again, this is all cited from your book. This is not me doing an external search. Falls, choking, sudden infant death syndrome, which is SIDS, and ingesting poisons are other critical safety concerns. Remember that these guys are getting their mobility, and with that, they are going to be putting things in their mouth. So we need to make sure that their environment is safe. They are considered tactile and oral explorers, right? So they like to manipulate objects, and they don't quite realize that how they're exploring their environment by putting things in their mouth is putting them at an increased risk for choking and poisonings. Our preschoolers, again, motor vehicle injuries continue to be a major barrier for accidental death. These guys also have drownings, fires, and poisonings. Falls are primary cause for non-fatal injuries for these guys. After age 3, children are a little less prone to falls because of their gross and fine motor skills and coordination and balance have all improved. However, they're starting to play outside. They're starting to climb more. So we have playground injuries, pools, front yards, and those all create additional safety concerns. Going on to our school age child, we have motor vehicle accidents still at the top of the list. School age children have developed more refined muscle coordination and control. Their decision making skills have improved. However, because they become more involved in activities, there's more chance of injuries from sports, skateboarding, bicycle riding, playground injuries are also common. Most school age children are ready to try new skills with or without practice or training. They're less fearful than our toddlers, and this exposes them to a whole wide range of environmental injuries. So there's that. And then we have our adolescents. So the leading cause is still motor vehicles, followed by homicide. Both of these frequently associated with alcohol and drug use. Sports and recreational injuries include diving, drowning incidences are also common, especially when they're drinking or using drugs while they're doing those things. They're going to be in their peak physical, sensory, and social motor abilities, giving teenagers this strong feeling of strength and confidence. They lack the wisdom and judgment that adults have. That puts them at an increased risk for injury. That combination, along with their feelings of being indestructible, makes them more likely to take risk-taking behaviors and makes them more prone to injuries. When we get into adults, adults poisoning is now one of the leading causes of death and injury, followed by motor vehicle accidents. Workplace injuries are also a significant concern. Other injuries are related to lifestyle, like excessive alcohol use, stress, carelessness, abuse, and decline in strength and stamina. For many, work and family responsibilities often leave little time for regular physical activity, increasing the risk of musculoskeletal injury for those weekend athletes. And then older adults. So we know that the body kind of naturally has changes that occur when we get older. These are just physiological changes that occur. These changes include a reduced muscle strength, joint mobility, slowing of our reflexes, a decreased ability to respond to multiple stimuli at one time. There are sometimes losses in sensory, particularly in the hearing and vision. These changes increase the older adult's risk for falls, burns, car accidents, and others. Falls are the most common cause of accidental death for ages 50 and older, and that's according to the CDC. So again, the physiological changes of older adults is what places them at a greater risk for falls. We have some individual factors affecting our lives, affecting our safety. So of course your lifestyle, if you're gonna ride your body like a roller coaster, eventually it's gonna break down. So if you're somebody who likes to do a lot of drinking, a lot of drugs, obviously there's an increased risk for injury. The cognitive awareness, any sensory issues, ability to communicate, mobility status, physical and emotional health, and awareness of safety measures, right? All of that. Awareness of safety measures in your house. So the most common cause of death related to house fires is going to be your smoke inhalation, poisoning, right? A lot of times with our little kids, we see poisoning because parents do not lock up or put away chemicals, but it can happen with older adults too. You can have somebody who's got a cognitive impairment and doesn't quite realize that, the bottle of something on the counter is cleaner, not something for them to drink. So we're going to go over some of these individually. First one we're going to talk about is fires. So open fires are a major cause of death and injury. Usually if somebody is involved in a house fire, they're going to succumb to smoke inhalation. Preventative measures that we can educate our patients about are smoke alarms. A lot of people say during spring forward and fall back, change out those batteries, have that fire extinguisher in the house, make sure that it hasn't expired. We don't want to leave candles unattended. Safety with holiday lights. I remember when me and my husband first got together, he had holiday lights plugged in everywhere, and I was freaking out that it was a fire hazard. Like, there should be no reason why we're using 10 extensions on one outlet to plug in all the holiday lights. So just little things that can happen. And care with electrical cords, right? Electrical cords are kind of a dual edge possibility of injury, right? Because electrical cords can cause a fire and they can also create tripping hazards. Next, poisonings, right? Household chemicals, leads, medicines, cosmetics, all of that can poison. Preventative measures is making sure that they're out of reach, that they're stored, locked. Poison control is a free phone call away. Their number can be found online. I think it's 888-222-1222, something like that. It's quickly Googleable, and they'll tell you what you need to do if somebody was exposed to something. The treatment depends on what they've exposed. Most poisonings We can give sometimes like an activated charcoal to stop it from going through the GI tract and becoming ingested. Other times we might have to give a different type of antidote. And you'll get into that when you get into more complex things in your med surg courses. Carbon dioxide poisoning, right? Carbon dioxide is the colorless, tasteless, odorless, toxic gas. Frequently, somebody's going to have some headaches, they're going to have some nausea, they might have some vomiting. As they get prolonged exposures, they're going to get seizures, dysrhythmias, unconsciousness, brain damage, and then death. Things that give off carbon dioxide exposure is if you have like a wood burning stove or something that's not well ventilated. Some of those old oil burning furnaces can do it. Burning gasoline, natural gases, kerosene without having good ventilation. CO2 can build up in a faulty furnace, and it can build up very quickly, especially if you have something that doesn't have good ventilation to it. A lot of people who attempt to hurt themselves will have the CO2 build up because they think it's going to be a slow, painless, and it's not. You're going to be getting headaches, nausea, vomiting, seizures, all of that before you actually pass. It is a medical emergency. And typically, if you work in an emergency room, you usually have a few people come in together because they're all living in the house having the same symptoms. Next, we're going to go on to scalds and burns. So this could be from hot water, steams, and grease. Scalds and burns are most common cause of burns in children age younger than 3 because they're reaching up and they're pulling down and they don't quite know what's coming down, and then it goes all over them. Warming food or formula in the microwave can lead to burns with kiddos too, because if the microwave heats the inside more than it does the outside. So if you heat a bottle up and you don't shake it correctly by the microwave, that's why they say don't do it with a microwave, it can end up burning your child. Sunburn is very common for first degree and second degree burns. And then scalding burns, especially to the heat and feet. Sometimes we have cigarette burns in children and other vulnerable older adults. If you see cigarette burns or scalding burns, or you're concerned about abuse, make sure that you report that abuse. As nurses, we are all able to report. Falls. This person's having a bad day, right? All right, so we want to prevent falls, especially in those that are older than 65. Things that can cause people to fall would be our environmental factors like slippery floors, lack of grab bars, toilet seats that are too low, or really hot beds. We also have health issues, so poor vision, hypotension, orthostatic hypertension to be specific, right? And that's when your patient has a normal blood pressure when they're laying up, and then they stand up and that blood pressure drops and they become getting dizzy. That's a big risk of falls. Or cognitive impairments, polypharmacy, arthritis, gait or balance deficits. All of that can affect your falls. Firearms. Firearms are big. If you live in a gun state, a state that allows people to just purchase firearms, you're obviously potentially at an increased risk for these. But people that want guns, they find a way to get them, whether they're legal or illegal. Guns, especially for youth and adolescents, need to be locked and secure. We don't want children to handle guns without having proper education with it. Household access to firearms has been implicated as a risk factor for youth suicide and domestic homicide, as well as unintentional injury. There was an unintentional injury recently where the child accidentally shot himself, and he is not and will never fully recover from that. Because of the frequency and severity of unintentional firearm injuries involving children, the American Academy of Pediatrics and other groups have mounted efforts to educate parents about firearm safety. So if you are going to be working with peds or in the emergency room, you need to be aware, if a parent comes in with a gun injury and the child's there next to them, you need to have that conversation about making sure that firearms are safe. Suffocation and asphyxia. So drowning, choking, smoking gas inhalation all fits under that category. Our children 0 to 4 are at a high risk because remember, they explore the world through their mouth, so they put little things in there and they can choke on them. So we want to make sure that we watch for small parts, removable items. We want to make sure that we're cutting their food into the right size pieces. We want to pay attention to strings, cords, plastic bags, barriers to pools, and all of you should know the Heimlich maneuver. I know that it's not supposed to be called that anymore. I think it's supposed to be called abdominal thrust. But you all have BLS, so you should know that. You know that if you see somebody, even if they're making the universal choking sign, the first thing that you want to do is assess the situation, right? Are you choking? And they should nod yes to you, right? They're not going to be able to say yes, they're choking. Something's obstructing their airway, so they can't get air past their vocal cords to talk to you. And then you need to ask permission. You don't just want to jump in and perform the Heimlich maneuver. People have broken ribs and been sued for that, so just be mindful. Take-home toxins. Take-home toxins are hazardous substance transported from work to the home place. The National Institute of Occupational Safety and Healthcare reports that pathogenic organisms, asbestos, lead, mercury, arsenic, pesticides, caustic farm products, and dozens of other agents cause significant morbidity and mortality in workers' homes. These toxins are most likely transported to the workers' homes on the workers themselves, their clothing, or an object brought from the workplace into the home. This contamination can occur within 3 sources, so that we have our arthropods, which would be your ticks. Ticks can give Lyme disease, dust particles like inhaled things, anthrax spores, arsenic and arsenics in mines, and smelter dust, or direct skin contact by contaminating clothing. If we are exposed to something that is contaminating our clothing, such as mercury, or at this point in time, I've had a few lithium batteries explode in people's pockets. You want to make sure that when you're contaminating somebody, getting those toxins off, that you remove the clothing first. Because if you start washing the skin when that toxin is on the cloth, you're just going to spread that toxin further into the fibers of the clothing and expose more skin to it. All right. So safety hazards in the community, motor vehicle injuries, pathogens, pollutions, weather hazards. For motor vehicle injuries, right? I just told you a whole bunch of fatalities for children is due to motor vehicle accidents. Either they don't use the seatbelts correctly, they're not installing the car seats correctly, they're using alcohol or some other type of drug. This accounts for about 37% of all accidental deaths. Failure to seat belts and proper child car seats continues to be that major contributing factors. Severe injuries and death occur from airbag deployment when the child is improperly placed in the front passenger seat. Many of the fatal motor vehicle accidents during adolescence involve alcohol and substance abuse. Driver distraction by texting or talking on the cell phone is also a contributor to motor vehicle accidents. The risk of being injured or killed in a car crashes actually increases for older drivers. Every day, on average, 500 people over age 65 are injured in an automobile accident. So how do we prevent this, right? We make sure that our child is appropriately in the seat, that they're sitting where they're supposed to be in the car. If they're supposed to be face backwards, they're face backwards. Not texting, no loud music. Don't be a distracted driver. Pathogens, we can have foodborne pathogens that cause us to have food poisoning. Non-specific term that describes illness caused by ingestion of bacteria or organisms or their toxins in food. It can be caused by improper storage and preparation of the food. Raw foods are commonly associated with full foodborne illness. Your book gave the example of raw meats, cooking poultry, eggs, raw shellfish, raw fruits, vegetables, unpasteurized milk and fruit juices. Poisonous chemicals in the environment, such as mercury, arsenic, zinc, and potassium chloride, can also contaminate our foods. And we need to make sure that we're educating our patients in a way of preventing food poisoning. We can have vector-borne pathogens, so organisms that transmit bacteria, viruses, and protozoa from one host to another. This could be our mosquitoes, insects, rodents, birds, and other animals. And then we have waterborne pathogens. So people who live in substandard housing might not have safe drinking water. They might not have hot water to actually wash their dishes correctly, or they might have inadequate methods of disposing their waste. People in rural areas depend on private wells, which can also become contaminated with things like E. coli, right? And all that happens because of pollution. So pollution of our water, and there's also pollution of the airs and the soils. And if the soil's polluted, and then that gets into the water, other pollutants that you might come across is radon, carbon monoxide. Then we have our weather hazards. So weather conditions play a major role in outdoor recreation programming. It's important for professionals, participants, and outdoor recreation providers to understand severe weather conditions and the dangers that are associated with them. Suggest that patients have a weather radio receiver, warning, alarm tone, battery pack, receiver warning bulletins. They should check the weather forecasts and be prepared. So I'm just looking ahead and okay. So if you are a home health nurse, right, and that would be more of who this would be speaking to, is somebody who's thinking about doing home health, maybe working in a doctor's office, right? If you have a patient who's maybe event dependent, they need to have a disaster plan, right? So what if the electricity goes out? Well, how long's their event going to have a backup battery for? Does this patient need some type of generator installed in their house, so that way if the power goes off and it stays off for an extended period of time, they have a way to keep their vent going? And looking at these different pictures, floods are the same way. I grew up in an area at one point that would always flood, and for us, my family, it was really no big deal. Our house was elevated enough, no water got inside, it was never an issue. Other people that live in flood zones, when the flood happens, they can be trapped in the house, they might lose power. It can grow mold. So if you have a child who lives in a flood zone and they have a history of asthma and breathing problems, after a flood, they're going to have spikes. So making sure, again, the family has a disaster plan, they know where they can go that's safe, and then they can have the resources to have things cleaned up appropriately so that the child doesn't get exposed to mold and not have problems. So weather hazards, being aware of how it impacts your community, how it impacts your clientele, and what you can do to help them identify their disaster plan, shelters, and then recovery processes. So safety hazards in your healthcare facilities. Never events are also known sometimes as serious reportable events, SREs. They are things like health-acquired complications, serious death or injury to a patient. They are things that should never, ever happen in a hospital. Okay, the list of never events has been expanded over time. It's clearly identifiable, measurable, serious, and they are usually always preventable. Root cause analysis, which is RCA, tries to solve a problem and identify and correct the underlying cause of the event. So if you had a never event, they're going to want to conduct a root cause analysis of what happened, why did it happen, and how we can prevent it from happening again. Some hospitals will do a root cause analysis with any incident report. Depending on the level of the incident report will be how in depth the root cause analysis is, and if you will get pulled in. Professionally, I've been pulled into root cause analysis of events that occurred on my unit that I wasn't even part of. And the reason for that is that they want to see, well, if you were in this situation, would this have happened too? So they'll sometimes pull in extra people. They might pull in people from outside your unit. Um, a root cause analysis can be a really great experience, and it can be a very nerve-wracking experience. So try to think positively about it. And then a culture of safety. Any facility that you work for should have a culture of safety. It should be positive. Nursing unit culture helps improve patient outcome. Culture is going to be the way of thinking, behaving, and working, and it should be organized. Your key point is that culture of safety, nurse practice, and an effort where all staff work together to create a safe unit, disclose errors without free, and address safety concerns. It should have teamwork, communication, transparency, and accountability. And you will find some units have a great culture of safety, and other places you will not feel that. And I advocate for you to work someplace that you feel has definitely a culture of safety. So, hazards in your healthcare facility, what do we have? Falls. Falls are the most common incident reported in the hospital and long-term care facilities. Risk factors for falls: poor vision, cognitive impairment, difficulty be walking, and difficulty with balance, orthostatic hypertension, weakness, dizziness from disease or from their therapy, drowsiness from medication. Many cases involve falling from a bed, and falls occur more frequently on nights, weekends, and holidays. Most agencies have established procedures and safety features to prevent falls. However, falls still occur. Alarm fatigue. Alarm fatigue is a real thing. We've realized that many nurses hear so many alarms that they basically tune all alarms out. What they suggest that we do to reduce our alarm fatigue is make sure that our alarm parameters are set correctly so that we're not being bombarded by unnecessary alarms. Equipment related accidents, right? We have equipment that malfunctions or it doesn't work properly, or somebody rigged it up to work because it was the last one, but it really wasn't rigged up appropriately. We can have wheelchairs and beds that do not lock properly, right? I've had that. I've had a wheelchair that didn't lock properly, and somebody just kind of jammed something in it in a hope that it would stay still, and it rolled a little bit. Luckily, nobody was hurt, but these things happen, and you need to inspect your equipment to make sure that that's not happening. Fire and electrical hazards. Most hospitals these days, if a patient is bringing anything from home, it should be inspected by biomed and given a safety tag saying, yep, we've looked at this, the wiring is appropriate, it's not going to cause a fire. Because you can have somebody that brings in something from home, the wires could be shredded and it could cause a fire. We don't want to do that. You can also have patients that decide to smoke, right? And if they're smoking in their room, that of course is going to be a fire hazard. Restraints. So restraints, We always want to make sure that we're using the least restrictive restraint as possible, that it's allowing the patient to free and move the most. Um, and then mercury poisoning, not really. For the most part, you're not going to see it too much. It's kind of been removed from the hospital system. Very rarely do we have thermometers at the bedside anymore that have mercury in them. Batteries are all being switched over to lithium. Um, some electrical equipment, some switches, but mercury poisoning, it's toxic. It can be acute, and they can also have chronic exposure. It can be inhaled, ingested, absorbed through your skin. It kind of accumulates in the muscles, and it can cause renal and neurological disorders, especially in fetuses and neonates. One of the reasons why they tell pregnant women not to eat tuna, because tuna is high in mercury. So, safety hazards for the healthcare worker, what you as a nurse might be exposed to, right? So, ANA reports 50% of nurses have chronic back pain, likely because many nursing tasks require bending, twisting, activities that can injure our bodies if we do not use proper body mechanics. Um, Nursing is definitely stressful. um, on our body. We're transferring patients, lifting them in bed, positioning them. So the ANA states that manual patient handling should be used only in exceptional situations, and when it cannot be avoided, you should be using assist devices whenever possible to limit the risk of injury on yourself. Another potential hazard for us is needle sticks. Healthcare workers, mostly nurses and housekeeping staff, suffer up to 1 million injuries per year from needles and other sharps that put us at risk for things like hepatitis B and AIDS, HIV. That is how I got my needle stick. Luckily, I did not get any infectious disease, but somebody put a not fully engaged device. It was a butterfly, and they didn't slide the cover up all the way, and it was hanging out of the sharps container on the back end of it and very short. So when I reached up to put mine in, I didn't see that the other one was there, and it stuck right into me. And this was a double occupancy room. So was it A bed? Was it B bed? It was several months of stressfulness. So needle sticks do occur, and you need to be safe, not just for yourself, but for your coworkers, because that could just as easily have been somebody from maintenance who was coming along to change out the container. Radiation injury. So radiation, um, if you work in a department, there's nurses that work in interventional radiology. I did that for a while. You'd be helping with procedures in CAT scan and nuclear medicine and all of those areas. And, you can be exposed to that stuff. Usually you wear a device that tracks it for you. Healthcare workers that work in these specific areas have that exposure. It's going to be small doses. You need to wear the appropriate equipment, turn in your little badges for them to be monitored. Violence is another thing. A lot of local hospitals right now are putting up signs that, aggressive behavior will not be tolerated. If you're working in the emergency room or someplace that has 24-hour access, sometimes it gets crowded, sometimes it gets chaotic. People are already stressed because they're there, and we can have violent outbreaks. So you just need to be mindful of that. And then same thing, sometimes if somebody's having a non-positive outcome, they might become angry. Family can be anxious and angry. I've had siblings get into full out fights over, plan of care, and this one wants to pull the plug and this one wants to keep them alive, and it happens. So you just need to be aware that violence can occur where you work. And then your preventative measures, I kind of talked about these as we were talking about the different ones. So looking at your whole nursing process for this particular thing, our assessment, You want to make sure that you're assessing the client's environment in the hospital. Is the bed in the lowest position? Is it locked? Are all their personal belongings in reach? Do they have non-skid sockwear on? Did you do a Moore's fall scale? Did you do a get up and go test? All of that stuff is important. The home environment, right? If you're a home health nurse or you're a nurse that's discharging a patient home, you might want to ask things like, do you have grab rails? Do you have those little throw rugs that have the non-skids on the back of them, or your throw rug's gonna, slide you across the floor? Do you have those little non-skid things in your bathtub? Um, and then risk for violence, right? This would be aggression, anxiety, and stuff like that. We want to make sure that we're sending a patient to a safe environment. So some concepts or diagnoses you can use risk for injury, risk for falls, risk for hypothermia, aspiration, contamination, poisoning, suffocation, trauma, um, and so on and so forth. And of course, any planned outcome that you're looking for in planning interventions would be based off what you decided. Some interventions for a safe environment would be educating, evaluating, removing the hazards, using technology, establishing goals. Technology, just to highlight on, right? If you have a patient who's falling a lot at home, we had a loved one who was falling a lot at home, and my uncle put in cameras throughout the house. He put them all at foot level so that he wasn't really invading anybody's privacy. But if they're at foot level when the person's then themselves at foot level, you could see them, right? So aside from her just having that help button that she could push, he also used those Wi-Fi cameras all over the place. Some other interventions, right? Preventing poisoning, lots of education here, right? Firearms injury, making sure that they're locked up, or that, maybe the guns aren't locked, but the bullets are, or vice versa. Teaching safety, self-care. So educating your patient on motor vehicle safety. There's car seat clinics that teach people how to put the car seat in their car appropriately. Food safety, right? You don't want to eat something that's been left out. You want to make sure that you're washing your fruits and vegetables, not eating things past the expiration dates, reducing pollution, all of that good stuff. So more promoting safety, preventing falls, non-skid software, things like that, coping with violence, reducing alarm fatigues. This little tidbit on delegation. So restraints, one safety activity you might delegate is applying restraints. You must first be sure that the person who is putting this restraint on is competent to perform the skill. Although you might delegate the application of this restraint, you cannot delegate the assessment of the patient's status nor the evaluation of the patient's response in the restraint. So you may assign, and having worked in a locked psychiatric ER, when you're tying somebody down, potentially, you will be the nurse, and then there will be maybe an aide with you and maybe a security guard with you. And if you guys are doing a 4-point application, it is okay for that non-nursing person to put that restraint on. But you, the nurse, needs to be in the area supervising it, assessing it, making sure that they still have circulation, and then removing it when it's time for it to be removed. And that is the end of this lecture. I hope you enjoyed it.